Hi, this is Dr. Garner back again. We have another one to share with you. This is the TFL Talk Down. And the reason it's important is because, well, for all kinds of reasons. You can't walk around with a stiff hip, but it won't allow you to take a full step if the TFL is too tight, and then you end up with other groin pains and symptoms that can cause other problems. But oftentimes the driver can be the TFL. There's a second problem here, because if you have any measure of hip dysplasia, it is hard to just stretch something out because you have some inherent instabilities or lack of range of motion available in the joint. So for this particular situation, if you have retroversion, hip retroversion, which means you might have more external rotation in the hip, so this movement, but not a lot of turning the hip in this way. You might have groin pain, for example, if you have retroversion. Now, a physical therapist can measure this if they specialize in the hip and the pelvis. If you're not sure, but you have tons of external rotation and not a lot of internal rotation, then you might be retroverted, and this may work for you. So here we go. We're gonna take a weighted ball, so not your standard typical squishy myofascial ball that I use it a lot, but this one is a 1 pounder, so it's filled with kind of a sand-like substance. So you're going to use this. It's a little bit more sturdy and resilient, whereas this one collapses more. So she's going to, our lovely patient model here, is going to put that right over the problematic area of the TFL, which is on the outside of the hip. So if I show you with this ball, it's about right here. If you turn your leg in and out a few times, it will pop into your hand. That's where you want it to be. Now, secondarily, if you're retroverted, which means you have more of this movement, but not a lot of this movement, then you're going to want to stabilize. Now, I'll move the camera a bit so you can see. I want her to put her toe down to stabilize the hip and prevent it from going into internal rotation. But I don't want her knee off the ground. I want the knee on the ground. And now, this is again where we have a bit of art inspired by science, where you're going to roll out the TFL while stabilizing the toe down, knee down, because again, just like in my other videos, if you're trying to release something, this right hip cannot be contracted. It does not work if you're contracting the muscle. It shuts you out of digging in. So if this is completely relaxed and I'm rolling my body over the top of the ball, then I can actually get into that deep relaxation state. What is that akin to? It helps my patients be able to prolong the positive impacts of me doing dry needling and manual therapy in the clinic here. So this is what I would give someone to carry over if we did dry needling into the scars and deep area of the TFL, but we want those effects to be more long lasting. Then this is one of the things that we can do. So how does that feel?
Feels really nice, actually. I'm finally getting a little bit of release from the compression, and I'm actually even wanting to hang out over that space too, which is really nice.
And she's making a really good point, and that's where we'll finish up, is that you need about 2 to 5 minutes of doing this in order to get an impact. This is not going to be a quick fix where you just get down there, roll around for 30 seconds and get up. You have to let the right hip relax, or whichever hip you're doing, and then really allow it to sink in. The reason I'm having her do it this way is, again, because of that retroversion. A lot of people will do something like a warrior one, turn the toe in, and then I'll have people tuck the tailbone. You can feel the length happen through here. You feel the tissue change. That doesn't work if you have retroversion. You'll just impinge your hip and pinch your labrum and maybe even tear it. So we want to protect that. So this is just informing the way we move through mindful yoga postures, which I call medical therapeutic yoga, while honoring the structure of the hip. All right, hope this helps.